Deficits and debt have always been part of American politics. This country was born into debt, and we started out $77 million into the hole. The reason why Washington, D.C. is where it is because there was a debt deal between Hamilton and his allies in the South trying to make this the state assumption of the debt into the national government, assuming all the state debts that were incurred during the Revolutionary War. There's an article in the Constitution, Article 1, Section 10, that prohibits state deficit spending as was known at that time. And it says states shall not emit bills of credit. These are bills of credit from the 1700s, including a Continental that was used to help finance the Revolutionary War. And the Madison was able to prevent at the Constitutional Convention this applying to the national government. Thomas Jefferson, our founder, in 1797 wrote a letter saying he hoped there would be an addition to the Constitution banning federal budget deficits and debt, and then in time of war, the states would take care of the finances. Of course, when he became president, he bought the Louisiana Purchase and put us in the hole about $15 million. Then he advised President Madison in the War of 1812 to go ahead and finance the war by using bills of credit. So there's one point about the history that this has always been part of our country. And the second point is that budget rules are always made to be manipulated and broken. In the 1840s, there was a whole plethora of laws requiring balanced budgets at the state level. The states are the incubators of evading budget rules. The thing like revenue bonds, special districts, the Port Authority of New York, these are all mosquito abatement districts. These were all created to evade budget rules. And then later on, the Republican Party found a way to finance its budget deficits by simply raising taxes. You would not know that, but the party of Lincoln is the great tax raiser of all time, and so they did by raising excise taxes. So all the way through until Franklin Roosevelt. So the question is, where does this limit come from? On the eve of World War I in 1917, and the second Liberty Bond law, they created a new financial arrangement in terms of the federal government being able to borrow money on a long-term basis as opposed to short-term. And that's the instigator of this law that requires when you reach the debt limit, you have to get congressional approval to go further. And so this law has been on the books for a long time, and for many years people have had to go to the well to get permission. So that's sort of the historical background, but the major point I want to make today is that it's how you talk about budget deficits that make a difference. How you talk about budget debt that makes a difference. Now, in September, a few weeks ago, the director of the Congressional Budget Office testified in front of the new Joint Select Committee on Deficit Reduction, which was created by the Budget Control Act that resulted from the negotiations over the debt limit, and he provided some testimony, and the testimony is very interesting. He said that our current budget deficit is $1.2 trillion, $1.3 trillion. It's going to decline in 2012 to 973, then 510, 265, and in 2015 the budget deficit will hit $200 billion, which is chump change in the way the federal government operates. But you would never know this, and this goes on through to 2021. The budget deficit never goes over $280 billion. So why is that happening? Because all you have to do is do nothing. All you have to do is follow the current legal laws and the expiration of the Bush tax cuts, a number of the provisions of law, and budget deficits will be down to $200 billion plus, which is nothing in GDP standards, let alone the national government's budget experiences. But we don't know how to talk about this. You would not hear this from Democrats. President Obama has not talked about this. The Democratic Party has not been able to talk about budget deficits probably since Lyndon Johnson. And it's a much more difficult thing for Democrats to talk about budget deficits and the national debt than it is for Republicans, because Democrats have to be able to tell people why budget deficits are good. That at a certain point level, budget deficits are healthy for the economy. And they've lost this capacity. There used to be something called the Full Employment Act. There used to be something called the calculation called the Full Employment Budget Deficit and Surplus, which was a calculation of what the budget deficit would be given what was understood as full employment level. But this level could easily be adjusted that if you took into account not just this sort of structural level about 4, 5, 6%, but if you took into account people who stopped looking for jobs, the people who are structurally unemployed, long-term people, and you adjusted this, in fact, your calculation of the budget deficit, we'd probably be running a surplus. But the budget deficit is not talked about, and the biggest problem is it's easy for Republicans to talk about budget deficits being horrible. It's easy for them because it's an easy idea to communicate. And unfortunately, it's harder for the Democrats, and nobody seems to want to talk about it. And so I will pass the mic to my colleague, and maybe they can answer other questions that they're posed.
To me or whoever.
Hello, everyone. You can never tell Deborah no. So when she called and asked if I would participate in this, at first I said, "Well, I've got a class," and she said, "It's okay. You can come late, and I'll even feed you." So,
What?
I work for food. With regard to the outcome of the debate, one of the questions raised in Deborah's flyer, in the Institute's flyer, what are the implications of the ongoing debate about the debt ceiling for the 2012 elections? And I'm going to come at you, I expect, from on kind of a tangential angle, but I hope that you will quickly see where this is going. I listened to the tenor of the debate, and one of the phrases that really struck me and got my attention was "skin in the game." Do you remember hearing that? And it was said on more than one occasion that certain people could not be heard from because they had no skin in the game. And then a couple of persons on the Republican side, although I will quickly point out that this is not unique to Republicans. Democrats have also used the phrase. But certain taxpayers, certain Americans could not be heard from. 47% of those of Americans do not pay any federal income tax because they are not participants in funding government. That's, at best, disingenuous. And it's actually worse than that. The fact of the matter is that if you think about this more carefully, I think you would pretty quickly conclude that we all have skin in the game. And let me explain briefly what I meant. I've got the start of a new paper here. I've got about a page and a half of paragraphs, and then it digresses to outlines. But here basically is what I'm thinking. First, and you understand that skin in the game requires that every interested party have something in which they're personally interested. If you want to influence the outcome of a debate, whatever it is, then you must have something at risk. If you have nothing at risk, then nobody needs to pay any attention to you. It's been suggested that Warren Buffett was the first to have come up with this. I did a little research, and it turns out that Buffett was not the originator of the phrase. Indeed, it may be it may be almost 200 years old. The first editorial reference to it apparently is in a 1912 news report, which referred to someone who was ignored because she, in that case, did not have any skin in the game. It may have been first introduced in political discourse by Senator Tom Coburn in 2006 when the Senate was considering health care accounts, but it has also been used by personalities as varied as our own President Barack Obama, who referred at one point to everyone having to have some skin in the game in order to become a part of the solution instead of the problem, and also our own Mark Warner, who also referred to skin in the game. So it doesn't have any particular political genesis. It doesn't belong in one camp or the other. But I think in this latest context, it's a matter of particular concern. Now let me explain why I assert that there is no such thing as an American who has no skin in the game. We must remember that we're dealing with a federalist system of government. That means that we have governments on 3 levels, federal, state, and local. Further, each level of government is expected to pay its own way. On the federal level, that's accomplished largely, but not exclusively, through the federal income tax. Approximately 60% of the federal budget is generated by federal income taxes, but the other 40% comes from a variety of sources, up to including excise taxes like the gasoline tax, and guess who pays that? Everybody, okay? On the state level, if you think about it, Virginia relies heavily, as do most states, on a combination of retail sales taxes and personal income taxes. About 30%, about a third of the budget comes from each of those, and then there are a variety of user fees and charges. Virginia has one of the most regressive income tax structures of any of the 45 states that uses it. That means that when you look at its impact on citizens, those who have least are most adversely affected by paying the tax. They have less disposable income, but because of the way in which the rates are structured, first, they're not exempt to the same extent as they are on the federal level. You can have exclusion on the federal level without having exclusion on the state level. And so the exclusion doesn't go nearly so deep. The rates are much more regressive. So not only are they taxpayers, but they also, from the point of view of the impact on the taxpayer, they pay more than their fair share. That's true for the income tax. The state tax, the sales tax, of course, is notoriously regressive. The response to that, of course, would be that there are exemptions, but if you think about the extent to which, for example, Americans in general eat out, fast food places, have you ever noticed the amount of retail sales tax that you pay when you get that hamburger and that order of French fries? It's only pennies, but pennies mount up. And of course, everybody pays that. There's no exemption for fast food, and there's no exemption for many of the items that you purchase at the local supermarket. The other large element relied on the state level in particular, is so-called sin taxes, tax on alcohol and cigarettes, and they too are potentially regressive. They are, in fact, regressive. Now, one response to that is, of course, to say that these are voluntary. Nobody makes anybody drink, and nobody is forced to smoke. But the fact of the matter is that these are very heavily taxed commodities, and guess who engages most heavily, who indulges most heavily in that behavior? Lower income citizens. So again, we have a system that tends to be extremely regressive. Skin in the game? I think so. And by the way, let me mention that in terms of political leverage, there really isn't that much that comes from bearing this kind of tax burden. First, the state legislators are much more concerned with higher income taxpayers. They're afraid if they raise the rates, these people are going to walk, and they lose some important part of their tax base. They will move from a high tax state to a low tax state. Well, I'm not sure how that cuts in a place like New York, where it seems you can tax New Yorkers right through the ears, and they're not going anywhere because there's no place in the world like New York. But this is kind of a common understanding. It's accepted by legislators, even though there's been relatively little research, that if rates are raised, the more affluent are going to leave. And so you've got that. Retail sales taxes, any attempt to influence that structure is going to be met with, well, you've got exemptions already. We've got exemptions for food. We've got exemptions for drugs. What do you want? What more could we possibly give you? Again, with regard to the sin taxes, that's behavior which is voluntary. And I must share with you one story in Texas. Texas, like many states, has had questions raised about the manner in which public education is funded. And in one of the interminable debates in the Texas legislature about how to equalize funding for education, one of the very bright Texas legislators said, I know, let's get everything that we need from a cigarette tax, and then we can pay for public education in that way. Now, that's really quite diabolical. First, it shifts the cost to a very small segment of the population. Second, can you imagine a strong lobby composed of those who smoke? We need to have relief from the burden of this tax. Come on, that's not going to go anywhere, and we know that. A complete absence of political leverage. Well, let's go on to the local level. What's the biggest mainstay on the local level? It's still the property tax. There have been a lot of changes, and there additional support from other areas, but the property tax is a political mainstay on the local level. And if we think about how, how that's borne by less affluent taxpayers, of course, there will be some home ownership, though clearly not to the same extent as with those who are, in fact, more affluent. But they're renters. And the costs of maintaining rental property are passed through to persons who are renters. And one of those costs is what? The property tax. Second, whether you know this or not, business property tends to be taxed higher. It bears a higher assessment ratio than does residential property. So not only are they paying property tax indirectly because the cost is passed on to them from property owners, but it's probably a higher rate than would be true if they were homeowners, because business property is taxed more heavily under property taxes. Skin in the game? I think so. And so what I intend to do in this paper is to show that, and this is a neat phrase, I walked around for 2 days as I thought about this one, to show that, where is it? I want to share it with you. Can't find it now. Basically, it's those who would assert that almost 50% of Americans, those Americans who pay no federal income tax, that assertion is analytically compromised and therefore specious. I'll stop at this point.
Okay, thank you. And thank my esteemed colleagues for such good comments. Appreciate it. When I thought about the questions that Deborah sent me, I wanted to think somewhat in a historical context and also think globally about the questions. And one of the themes that emerged from my thinking was this whole idea about race and class that seemed to me to be left out of the discourse occurring with the debt ceiling crisis. Let me say first that the current debate about government spending and priorities, as we all know, as it pertains to social programs, et cetera, is not new. We see this with the establishment of the Freedmen's Bureau in 1865, the New Deal legislation in the 1930s, the Great Society programs of the 1960s, and we also see it in the 1990s when we have this discussion of debt pushing up against social welfare programs of the 1990s. So we're the poor in this discussion, and also where are the African Americans? We have an African American president. As we consider the debt ceiling and the debt ceiling crisis today, I hope we can place this discussion that we're going to have within a larger historical context of the black experience and consider how African American intellectuals, i.e. Du Bois, Cooper, Anna Julia Cooper, and others attempted to address this issue. Of course, I am first reminded by the ideas espoused by W.E.B. Du Bois in his seminal Black Reconstruction, in which Du Bois argued that although blacks were in the forefront of establishing free public education, government support would eventually be necessary to bring free public education and social welfare programs to the masses. In trying to understand the racial dynamics beneath the surface in the recent debt crisis debate, I'm again drawn to Du Bois's Black Reconstruction, particularly his political economy analysis that helps us to understand the impediments to the unification of the poor black and the poor white worker against some of the draconian cuts proposed by both the right and the left in this debate. So I hope we can also, along with that, consider terms such as class warfare, which I've seen mentioned repeatedly just in the last few days, not only during the debt ceiling debate of a month ago, but just in the last few days. And consider, why is it being thrown around so much right now by the political right? And can we look to Du Bois and Black Reconstruction to see that the term, I would argue that we can see the term is actually a psycho-political strategy used by politicians, particularly on the right. I'm also reminded of the activism of A. Philip Randolph, who understood the connection between economics and politics in Washington, D.C. And I'm also reminded of Dr. King's seminal work that many people have not read. I think that has very, very important implications for understanding what's happening today. Where do we go from here? Chaos and community. In which King critiqued Lyndon Johnson's war in Vietnam and how the American neo-colonial adventures were taking funds away from the safety and social net of the poor in the United States. And particularly as it pertained to education, let me just read a quote from that book. King said, instead of spending relatively more on the disadvantage of the big cities, we are spending less. Another tragic example of the inversion of priorities which plagues American society. Very prophetic. King also says, much more money has to be spent on the education of the children of the poor. The rate of increase in expenditures for the poor has to be much greater than for the well-off if children of the poor are to catch up. These discussions seem to be lost in the debate that's occurring now. King goes on to discuss some of the very problems we struggle with today, particularly in the field of education: need to reduce class size, extra assistance for low-income children, and programs to connect families with schools. Such programs need governmental funding. With the draconian cuts proposed by the Republicans and many of the Democratic politicians, we'll see such ideas go to the wayside. And then I'm also perplexed by trying to understand why we have the emergence of the Tea Party at this particular point in our history. And again, we can go to Du Bois and get an understanding of this, but someone else provides, I think, some very important insights, and it's the historian Richard Hofstadter in his book on anti-intellectualism in American life, and more importantly, his book, The Paranoid Style in American Politics, in which he forewarns us about the Tea Party. He tells us that they're coming. So I'm excited about this conversation today. I'm going to stop here, and I look forward to it.
Thank you so much. I'm so pleased to be here on this panel to talk about recent political discourse. When I thought about the debt ceiling, the first thing that occurred to me is that all of us should care about it, mainly because the talk is obscuring what I think is really going on. And what I think is going on is that we're at an ideological crossroads, and it's very crucial. You know, I think about it. I'm from Memphis, and that's part of the Mississippi Delta. And I don't know if all of you know or familiar with the crossroads. You know, the old story of the blues legends meeting the devil at the crossroads to trade their soul for the ability to play well. We seem to be at that same crossroads. Are we going to be a nation of justice and equal opportunity, or are we going to be a nation where those with the most resources, you know, hold the most power and continue to exploit those that don't? It's interesting because the United States has always gotten into positions, as Professor Savage said, where we are in heavy debt. That's nothing unusual. And as you saw Bill Clinton do, in a matter of 2 terms, we had a surplus. And that is because the debt ceiling is raised just on a pro forma basis. There's no big deal about raising the debt ceiling. I found it amazing that all of this conversation and angst has been raised about something that's done all the time. And so that's why I say it is not about really debt and passing on debt to our children and grandchildren and all these other lofty ideas. I don't mean to minimize the trouble that we're in, because we're in trouble as individuals, and we know that. We see it all around us. People are suffering. But you know what I think is interesting? We have really stopped talking about where this all started, and that was with the housing meltdown. And then the bailout. Everybody now remember the first bailout with Bush the Lesser? That's my pet name for him. Bush the Greater and Bush the Lesser. And I think you know which one is Bush the Lesser. But the first bailout, you know we can't find it. Is everybody aware of that? The president hired Elizabeth Warren to try to track it down. She never found it. So that's why, because the money was given with no stipulations. What were they supposed to do? They were supposed to save people from losing their homes. They were supposed to loosen up the credit crunch so that people could make it. They didn't do it. And I thought about it when Professor Robinson was talking. Elizabeth Warren says that this whole Tea Party notion of rugged individualism and people building their own companies. And she said, if you have a factory and you're successful, that's wonderful, but you're transporting goods on roads that the American people built with their taxes. You did not get there by yourself. You did not construct all of the mechanisms that make you successful. The people did. And so she talks about that. So, I'm a political scientist, and I find myself unable to articulate sometimes because the whole discourse is so bizarre to me. I mean, I can't even negotiate my way, through the Byzantine, levels and aspects of this argument that's going on. This is a thing. Okay, we can start with the housing meltdown, the original bailout, and then go on to think about how much wars cost us. So we're in a war on two fronts, Iraq and Afghanistan, and then we had natural disasters. They always come along. The Medicare drug plan, a huge issue, a huge drain on resources. And it's really money for pharmaceutical companies. It's not helping old people. That's why buses are still headed to Canada to fill prescriptions. It's not helping. So we need more money, okay? When we all need more. I know I need more money. But, do we cut spending, and where do we cut it? Or do we raise the debt ceiling and start selling more Treasury bonds to make up for raising the debt ceiling? And so we find Tea Party members and the Republicans, they prefer this cut spending in social programs. So Medicare, Medicaid are set up for a huge hit. Who needs these programs? The working class and the poor. And they will cut defense spending a little bit, but not really enough probably to help. Obama wants to end Bush the Lesser's tax breaks for the wealthy, but the Republicans and Tea Parties do not want to end those tax cuts because for some reason we're still singing the song that those who invest run the economy. Trickle-down economics. And Bush the Greater himself called it voodoo economics, and that's what it is. It doesn't work. We know it doesn't work, but we're still, nobody's calling anybody on this. So it's kind of a sad situation, but I think we're in a serious ideological and power struggle, and that's really underneath all the talk about cuts, the debt ceiling, and how to bring people back to work and that kind of thing. So thank you so much.
Good evening, and let me join the chorus of thanks to Deborah for putting this panel together and for inviting me. I'm happy to be here. More of these kind of conversations should be taking place. I entered this conversation as someone who studies African American social movements for progressive change. That's the work that I do, and so I entered the conversation from that venue. So from that standpoint, where are we? And I think that Andrea's this issue of a crossroads, I think, is very accurate. If I look at that and if I think about the crossroads where we are, the question is, are we going to have not a better social contract, but a social contract at all? And if we think about what we've seen over the past decades, we've seen a retreat from racial justice, certainly, but more generally, I would argue a rolling back, essentially, or an attempts to roll back the 20th century with regard to social policy. So we see over time deregulation, privatization, this progressive elimination of the social safety net, attacks on collective bargaining, and overall a concentration of wealth occurring through tax cuts to those at the higher brackets. And that's been occurring for some time, and since some of this is coming to a head. And so I think in that context, Barack Obama's candidacy and the message for change, I argue, or I have argued, was mistaken for a social movement when in fact it was not. That it was an insurgent electoral campaign within the Democratic Party. He had to go around the Democratic Leadership Council. That's Bill Clinton, Hillary Clinton, Al Gore, Terry McAuliffe, so on, Joseph Lieberman, what have you, and even some of the established black leadership within the Democratic Party. Maxine Waters, who I like a lot, but she was part of that established. So it was an insurgent electoral campaign, but it was not a social movement, and I think people blurred the lines between those two. And I think against better judgment, I think many of us put too much faith in the charismatic leadership of an individual, in this case, Obama. And let me say up front, I voted for him, and I voted for him enthusiastically, so I'll say that. And I think, and this is the basis of my conversation, my point of entry to get here, the debt ceiling crisis, and I think the concessions to the right that were brokered by the Obama administration, I think dramatically illustrated how misplaced this faith has been in charismatic leadership, the heroics of an individual. And so I would argue that turning this ship around, the ship of state, society, if we're going to have civilization, and I really think, I was in class the other day, and had a student, and you can, from the mouth of babes, he said, we're talking about the possibility of like extinction socially. Turning this around, I think, is going to require, again, more than the activities of an individual. This model of charismatic leadership is one that I think we really have to put to rest. I think changing the trajectory of social policy, changing the national political discourse overall, that's going to have to come from below. And I argue, this might or may not be controversial, that as a historian of African American social movements, I would argue that African Americans have played a very progressive role in the history of this country and the movements that they have led, not people exclusively by themselves, but that they've been involved in. So if the United States is a more democratic place, if there's an expansion of citizenship, then I would argue African Americans historically have played a key role in that. So I would similarly argue that black people don't have the central role, but there is a role, I think, there as someone who does the work that I do. And so I think for this role to be fulfilled, I think in part that it tells among African Americans within the black public, that means critically and publicly engaging the Obama administration. That is to say, acknowledging the accomplishments, because there have been accomplishments, but also speaking in a public and critical way about the missteps. And I think one of the, within every crisis is an opportunity. That's one of the things that keeps me getting up in the morning, is to think in those terms. And I think one of the opportunities that this moment presents us is that we have the possibility for the renewal of a robust black public sphere. That as someone who grew up in the 80s and sort of living through the decimation of that, I think that this creates the possibility. And so that's why I was proud of members of the Congressional Black Caucus, who I've been critical of on in other occasions during the debt ceiling crisis, who broke very publicly with the party in general, with the administration in particular, and voted against this deal. Now, they lost the vote, but I often think of one comparison that one can make, and it could be a strained comparison, was the activities of the Mississippi Freedom Democratic Party in 1964 at the Democratic National Convention in Atlantic City, where rather than accept a half concession of some kind of representation, they went to the mat and, listen, if we can't unseat the Democratic Party regulars who are segregationists, who are against the party, whose activities are against the laws of the land, then we will not accept it. And one has to be careful about how we make these parallels, but I was proud of them. And on the flip side, I was disturbed. I have been disturbed, and this is the essay that I wrote, by comments by individuals such as Tom Joyner, who I listened to growing up in Chicago. I like Tom Joyner. Steve Harvey, who is funny, who I like a lot. Reverend Al Sharpton, who on a number of issues I think is very, very articulate and very politically sharp. But very concerned about their attacks on Tavis Smiley, who I've got a lot of problems with, and I think Steve Harvey was right to call Tavis arrogant. But nonetheless, Tavis, Cornel West, I think made some legitimate criticisms, and it's one thing to disagree, but to subtly to challenge their authenticity, to suggest that somehow they're treasonous at their Uncle Tom's, for me, I think was very, very troubling. And I think could be calamitous, I think, for the possibility of a renewed black public sphere. I'll end on this note. I think like many of us, as I said, I voted for Obama. I was proud to do so. And I think like many people, I desperately want the president to succeed. But I think to some extent we have to decenter Obama in the conversations and begin with the conditions, the challenges, the welfare of the broadest numbers of people in general, but certainly African Americans who, if you look at the wealth gap, unemployment, incarceration, I mean, this past decade, and we can't put that at the feet of Obama by any means, but this past decade, I mean, it's been very catastrophic. And I think we have to begin the conversations there. And if pressing for those issues, speaking in those interests, entails criticizing the president, and to help him to be the president that many of us voted for, I think we have to do that. And I think those of us who are in African American history, who are in black studies, who have studied the black experience, I think are in a very unique position to kind of intervene in these conversations and not just leave it to, the pundits who write these books that are flashes in the pans. Now, last point, and I promise, the American Jobs Plan, American Jobs Act. I'm hopeful. I think there are a number of ways to interpret that particular maneuver. There's a cynical way to interpret it. I prefer to interpret it more hopefully, that in fact, that it might be a hopeful sign that the pressure from President Obama's base has had an impact on the kind of maneuvers that he's making now, even though I think we still have to remain vigilant and we have to be complacent. The presidency has been an aid historically to movements and agendas for an expansion of freedom and democracy and citizenship, but there has to be that other half of it in terms of that being popular participation and pressure and discourse. And I'll stop there.
Good evening. I'm going to talk about how the talks about the budget deficit and cuts are affecting our clients, who are mostly poor people and low-income wage earners. When you talked about the president, I don't know if people heard him when he did his State of the Union address in January, but he stated right out openly that he would have to more or less sacrifice some programs that were near and dear to his heart, including community action, which is our program. We all kind of like our mouths just fell open. He actually said it publicly loud enough that the Congress went back and cut us 50%, but we had some supporters in Congress that fought for us, so we wound up losing about 6% nationally, but we don't know where we are this year. We're probably on the chopping block because he put us out there. To our surprise. What I want to talk about is leveling the playing field, and if we're really a country of opportunity, how we provide equal opportunity for everyone, particularly our poor people and our low-income, our minority people. The programs that we generally have are programs to help people become economically self-sufficient. Most of you have heard of the Head Start program. Our funding is through what's called discretionary spending. They have the mandatory spending in Congress, then they have discretionary spending, and it's about 40% of the national budget. But out of that 40%, 44% is military spending. So we're talking, when we get down to it, probably less than 18% for other discretionary purposes. And the Community Action Network of about 1,000 agencies nationwide, our total budget is $700 million. So you can see how tiny our budget is and compare it to the whole national billion-dollar debts. We're a minute part of that budget, yet we're always on the chopping block. Every year we get cut, every single year, and our programs are helping those most in need. Some of the other programs that are up for cuts or reductions this year are going to be the Earned Income Tax Credit. That's a program to help low-income wage earners get quite a bit of money. It's probably the largest source of revenue for the low-income community in the nation. It's the largest, most impacting source of revenue. And they're talking about making reductions to that program or cutting that program out as well. Some of the programs to help children, an education program, Head Start, has been looked at for possible reductions. Some of the programs like SNAP, which is the new food stamp program, although it's a mandatory program, they're looking at changing the eligibility requirements. So some families who now are eligible for it will no longer be eligible for that. The same thing with Medicaid. states can determine the eligibility there. So some of those folks who were eligible may not be eligible. And let me give you an example of a poor family, a poor person who's just started working. You have a single mother with maybe three children, let's say. And for our purposes, 100% of poverty is $22,350 for a family of four, and 125% of poverty, which is eligibility for our services, is $27,938 for a family of four. For our Head Start program, it's 100%, which is $22,350. A single mother with three children who may start working may all of a sudden lose her within a short period of time, lose her subsidy for child care. She's getting a child care subsidy to help her to pay for her work. That might be cut down or cut out. She'll lose that. She loses her benefits. She loses her insurance. She won't get insurance. The children may continue getting insurance, but she might not get health insurance. And more than likely, her job is not going to give her health insurance, or she has to pay quite a bit of her earnings for health insurance. They cut out transportation. They cut down the amount of money they're putting into transportation for states. So maybe the bus route that she'd take to work is no longer available. So she has a problem getting to work. Can't get to work, can't get subsidy on child care. She has to figure out how to pay child care, and she can't even get work or get transportation during the hours that she needs to work, so she may lose her job. She may have problems getting food, as food stamps, probably the amount of food stamps will be cut because she has an income now, and so she won't be able to feed her family like she did before she was working. So what's the incentive to work? What's the incentive to work? Because she's going to lose more than she gains by working. We had money from the stimulus, federal stimulus given to us last year. All community action agencies did. We took part of ours, and started what we called the Back to Work program, a training program for low-income wage earners to help people get some kind of a trade so they could have a profession they could make a decent wage in this area. So we looked to see what was available in this area in terms of employment, found out that healthcare was probably the biggest area of hiring. So we contracted with Piedmont Virginia Community College and partnered with the Virginia Employment Commission to get people to our office so we could put them in programs, training programs through the Workforce Development Department at PVCC. Most of them we put in CNA or medical records, medical billing, those type of professions. But we were able to give people training so that they had some kind of a field, some kind of a job skill that they could go out and get a job in this market here in Charlottesville. But the other thing we did is realizing that there are barriers to employment. We put in some other things. We helped them with transportation. We either gave them vouchers for gas, or we gave them bus tickets. We even did car repairs for people. We paid for child care. So people needed child care to take care of the kids. We paid for child care while they're training until they got the job. We also helped them with rent and utilities because we were trying to eliminate all the barriers why they could not go to class and finish and complete this program. Those are the types of programs that are most effective, that most help people in need. People seem to think that poor people can just walk on out and get a job and everything's going to be fine. There are a lot of other things you have to consider. How do you stabilize the family? How do you make sure child care is taken care of, transportation is taken care of, that they have enough to cover all their expenses until they completely finish their program? So when they start talking about cutting out and deficit reductions, the first things to go are the job training programs. The first things to go are the subsidies for transportation, the subsidies for child care, the things that are important to low-income families to help them get on their feet. So I'm talking about leveling the playing field, providing opportunities for everyone to be successful. How would we do that? Rather than budget deficit reductions, what I'm going to suggest is we increase our revenues. The current revenue source for the United States is income taxes, 45%, Social Security taxes, 34%, corporate taxes, about only 12%. Excise taxes, such as the cigarette tax and the other tax we were talking about, 9%. 12% of our revenue is from corporations. What a break they're getting. The rest of us, to compare it to income tax, which is 45%. I say that now that we know that the oil companies are making record profits, let's tax them. I mean, why should they get a break? I still have to pay my taxes. They get a break. What about the high income folks like Warren Buffett from Omaha said he is taxed less than his secretary. Yes. And that's absolutely ridiculous. How could he be taxed less than his secretary? I was unaware of the big tax difference. And so when I was young in my career, I was doing employment law. I went to a conference in Iowa on employment law, and one of the speakers was the Attorney General, a woman of Iowa. And she was pretty good, and a few months later I saw in the paper that she was running for governor of Iowa. So I was reading up on her, and in this article it said that she and her husband, who were millionaires, paid zero tax that year. They had paid zero. I said, how is that possible? If somebody's a millionaire can pay zero tax, and I was paying tax. I wasn't nearly making that kind of money. But because of their write-offs and all the loopholes, they paid zero tax. What is fair about that? A poor person is working, still going to pay taxes. Why is it that the people with the most money are paying the least? Let's level the playing field.
Good evening. My name is Ridge Schuyler, and I want to thank the Carter G. Woodson Institute for holding this panel, and thank all the panelists for their wonderful comments. And I'm going to close out here. I spent 12 years as a congressional staffer. I'm one of those, you read those anonymous congressional aide. I'm one of those guys. And it is very unusual for me to be able to speak with my own voice. Usually when I worked for Congressman Perriello, the recent congressman from these parts, I would have to say what the congressman believed and not what I thought. Well, tonight I'm going to say what I think. So anything that I say that might reflect poorly on Congressman Perriello or any of my other former bosses, I do apologize, but this is me talking. First of all, there's been some discussion about Warren Buffett and class warfare, and I'm just reminded of the quote that Warren Buffett stated earlier this year, which is, "There is class warfare in America, and the rich are winning it." So, it's a little bit of a red herring to talk about class warfare. The other red herring is the title of our discussion tonight is Politics of the Debt Ceiling Crisis. Well, as Mr. Savage says, this was a manufactured crisis. This wasn't a real crisis. We've had a statutory debt limit since 1917. We raised the debt limit 10 times since the year 2000 when George W. Bush was president. We didn't have a crisis. We didn't have a crisis because Congress knew it was something they needed to do in order to keep the gears of government functioning, and so we did it because the nation needed it. But we manufactured a crisis. Now, if you want to know what a crisis is when you lose 25,000 American jobs every single day, which we did during the first 3 months of the Obama administration. That was not President Obama's policies that cost us those 25,000 jobs a day. Those were policies that he inherited. That's a crisis. Manufacturing a debt ceiling by refusing to raise the debt ceiling, by saying, I'm not going to play that game, I'm going to take my marbles and go home, that's a manufactured crisis. So we had a manufactured crisis. Now, why did we have that? We had that because right now in the Congress of the United States, there are a group of people who have decided that they are going to use a strategy of taking must-pass legislation and holding America hostage and demanding concessions in order to pass legislation that must be passed. We just saw it earlier this week. We need to pass legislation in order to keep the government from shutting down. And there's not a very right-wing conservatives who said, I'm not going to vote to keep the government functioning. I want to hold out for more concessions. Now, why? What is the objective here? And I saw this as a staffer. I was looking at it as it was happening, as it was unfolding in front of us. Dual objectives. The first objective is an objective that has been long-standing in the Republican Party. It is the objective of having government wither on the vine. They do not like a big federal government. They do not like paying taxes. And so the objective is to have government wither on the vine, to use a phrase that Newt Gingrich made famous during the fight with Bill Clinton back in the 90s. But the other thing, the other very corrosive thing, is not just do they want to see government wither on the vine, but they want to see this president fail. Rush Limbaugh said it within the first days of the Obama administration. I want this president to fail. We are in the midst of an economic crisis. We are losing 25,000 jobs a day. That's 750,000 jobs every month. And he thinks the most important thing that should be on America's mind is having this president fail? If our commander-in-chief fails, that means our nation fails. And you call yourself a patriot, and you want our nation to fail? Mitch McConnell said, he's the majority leader, or he's the Republican leader of the Senate. He said the single most important objective of Senate Republicans is to make Barack Obama a one-term president. In the midst of the greatest recession since the Great Depression, he thinks the most important thing for Senate Republicans to do is make sure President Obama is a one-term president? That should offend every one of us. Whether you're a Republican or a Democrat, that should not be our single most important objective. Our single most important objective ought to be getting Americans back to work and getting our nation back on track, if you ask me. But I'm just a staffer, and nobody asked me. So I happen to disagree. I think the debt is a problem. I mean, I worked for Senator Chuck Robb, who is known as a very stingy man. He said in a debate with Doug Wilder one time, he said, I would take food from the mouths of widows and orphans to solve this debt problem. He said, I know that's a controversial statement, and Doug Wilder said immediately, that's not a controversial statement, that's a stupid statement. Oh, those debates did not go well. But here's why the debt is a problem. The debt is a problem because interest payments on the debt crowd out other more important spending. When we talk about wasteful spending in America, I cannot think of a more wasteful dollar spent than money we paying interest on the debt. Our interest payment this year, fiscal 11, $225 billion we're paying interest on the debt. You know what we're paying for education? $95 billion. When we're spending $225 billion and that money goes to bondholders, half of whom live overseas, so that money is leaving our economy, right? That is wasteful spending. So in my view, we need to get our arms around the debt problem because it's crowding out more important spending. We spend $1.1 billion a day in paying interest on the debt. That is too much. We could spend that $1.1 billion a lot better ways, and just ask Karen how we could do that. So the debt is a problem. But if you're going to solve a problem, you got to look at its cause. What is the cause of our deficit situation right now? We know that when President Clinton left the White House, we had a surplus. We hadn't eliminated the debt. Debt had been accumulating for many decades. But at least we've got our house in order so that we were taking in more than we were spending. For the first time in decades, under a Democratic president. And then what happened? What happened was wars. Not paid for. Borrowed money to pay for wars. We borrowed money to pay for tax cuts. Why would you borrow money to pay for, if you're not bringing in enough money, why would you have a tax cut? Well, the idea was it would spur the economy. What happened? Recession. That's the third thing that hit us. And the fourth thing was the unpaid for Medicare prescription drug benefit. We expanded Medicare to pay for prescription drugs for older folks, which is fine, but we should have paid for it. It's a matter of priorities. If we think it's important to have a drug benefit for seniors, which I do, then we ought to pay for it. We should not pass that cost on to our children, especially when we're giving ourselves tax cuts. So that's what got us into this mess. Those four things dwarf any policies that President Obama has enacted since he's been in office in terms of adding to the deficit. So if you're going to solve that problem that's caused by wars, recession, Medicare spending, and a recession and tax cuts, what is the solution? Well, the solution we came up with because of this debt ceiling crisis was to cut more from discretionary spending. What is discretionary spending? Discretionary spending is what pays for roads, schools. It's what we invest in ourselves. It's what the university gets to do paid grant research. That's discretionary spending. We are cutting off the investments we're making in ourselves, but that wasn't the problem. We didn't get into a hole because of discretionary spending. So why are we going there for our cuts? So the first part of solving the debt ceiling, the crisis, the agreement that was come up with, was that we would cut $914 billion from discretionary spending. And then the super committee is going to find the rest of the savings somewhere. But taxes are off the table, according to Republicans. But it was tax cuts that got us into this problem. So why isn't adding tax revenues back part of the solution? I don't understand it. Well, I'll close by saying that if we want to improve the economy, we need to invest in the things that improve the economy. Cutting discretionary spending is the opposite of what we should do. In 1971, our budget, 58% of our budget was discretionary spending. Now it's down to 37%, most of which goes to defense. We are not investing in ourselves. We're not investing in our roads. We're not investing in our schools. We're not investing in our universities. And it will cause us economic harm in the long term. We are cutting off our nose to spite our face by cutting discretionary spending. It is the wrong way to go. So why hasn't the president been more successful in figuring out a way to improve the economy by investing in discretionary spending, by increasing revenues, and by reining in healthcare costs. That's the other big driver of our deficit. Our healthcare spending, both because of aging population and because of rising healthcare costs, that's what's ballooning our deficits. Why aren't we going after those things? Well, the president tried to do that. In the healthcare bill, he cut $500 billion of overpayments we were making to Medicare service providers. Back in the 80s, Medicare providers said, we can do this cheap. Private Medicare providers said, we can do this cheaper than the government. The government's overhead for paying for Medicare is 3%. They said we can do it cheaper than that. Well, the overhead for these private Medicare providers, 14%. So what the healthcare bill said is you get paid just the same that the government gets paid, no more. So we cut money to providers, and the Republicans ran ads saying that we were cutting benefits for seniors. And we saw the ads in our own district. I couldn't turn on the television without seeing an ad that said Congressman Perriello would cut $500 billion for Medicare beneficiaries. Not true. We tried to rein in some of the overspending to providers. But you cannot solve the problems if you don't have a willing partner. And that's what I want to respond to, the issue about President Obama. He is the President of the United States, but we have three branches. He needs the cooperation of Congress. He does not have it. We let him down in 2010 by losing good members of Congress who could have helped him, but they are no longer there. So the president now has a very pathetic Congress with which to deal. And unless we elect a more willing partner, we're going to get more of the same. He's got to cut deals. He could not afford to let America default on its debt obligations. But nothing would have made the Republicans happier because it would have been Obama's fault. In fact, they blamed him when Standard & Poor's downgraded us 0.5%, saying that it was Obama's fault. Well, he's not the one who was standing in the middle of the road saying, I'm not going to do this unless you accede to my demands. So he needs to have a willing partner, and without a willing partner, you can't get the job done. So he needs a willing partner in Congress. He doesn't have it now. Thank you.
Thanks to the panelists. We will spend the remainder of our time hearing from you, engaging with the panelists, and in any order. I'll try to get the mic. Do we need a mic? Do people need mics if they're going to speak from the audience? Okay. Does it come off the hook?
This gentleman.
Here you are, sir.
First of all, I want to just say thank you to the panelists. This has been very interesting, very insightful. But I have come to several observations I just want to ask you about. I think the biggest part of the budget is our military. And it seems to me, and this is something I'm going to just present to you to think about. If I were to ask you what is the most successful business in the world, what would you say it is? Just curious. If you don't know, I'm going to tell you what it is. It's war. It's the business of destruction and construction. And the byproduct is death. And all the cemeteries. And somebody's getting rich on war. We have got to find a way to decrease defense spending. That is the fat apple in the bunch that's got to be cut. Otherwise, and these people you talk about, the poverty people, they need to vote. They need to vote. It doesn't cost me anything to vote. Get the people out of office instead of doing this. And the whole thing in a nutshell is to stop Obama. It's in a nutshell. It's, the gorilla in the room is still racism. That's all.
Amen.
My name's Marcus Martin, and I'm a professor of emergency medicine, and I'm also vice president and chief officer for diversity and equity. And I'll stand up here because I don't want to. This court is just a little bit short. There are some other folks in here from the healthcare system as well. I see Dr. Prey and Dr. Preston Reynolds here, so they can correct me if I make some incorrect statements. But Professor Simpson and Mr. Scott, I think you all made some great comments related to healthcare. Specifically, I think you were talking about Medicare. There has to be some fundamental changes that we all make, not just the government, but we as consumers as well. I take a group of students to St. Kitts and Nevis in January. For a January term, we talk about healthcare, disaster preparedness, and the nuances of the cultural differences in developing countries versus a country like the U.S. And the per capita expenditure in St. Kitts and Nevis is about $375 per person. here in the United States over a handful of years has gone from $6,000 to $7,000 to almost $8,000 per capita. So we're the most expensive in the world. I think everybody in here pretty much knows that. Twice the cost of Great Britain. And then there are some countries in Africa that the per capita expenditure per year is about $30. Can you imagine that? So it's all about how we consume and what we want. We all want that hip replacement. We all want the coronary artery bypass. So those countries that do almost as well as we do in terms of longevity emphasize preventive care and primary care. We focus a lot on tertiary care, which means that we use the most expensive equipment. It means that we allow blocks in the use of generic drugs at perhaps 100 times less the cost, or maybe 10, 15 times the significant less the cost of a brand drug, just because of the legal ramifications, patents, and this, that, and the other, and the control by drug companies. So there is quite a bit of waste, fraud, and abuse, and we need to clean that up. And I think in terms of Medicare, as we all get closer to that age, and some folks are probably already at that age, I know I'm pretty close, it's that alphabet soup that we have to learn. It's Medicare A. So it's in-hospital expenses, and there's ways to cut some of the expenses there. It's Medicare B. We all don't want to have to pay additional premiums as we get older, but those who can afford it may have to. And there's Medicare C, which is the advantage care that you're talking about in terms of the private companies taking on the Medicare management. And so has been some waste there. And then there's D, the insurance part. And then there's one that bothers me more than the rest, because I think we can find waste in all those. There are a couple that bother me. One is cuts in medical education, graduate medical education. So that's going to be possibly about $10 billion over the next 10 years or so. We already have 90,000 less doctors than we should have based on effective supply over the next 10 years. It's a 90,000 shortage. Okay, you couple that with the fact that 30 million more people will have access to health care that didn't have it before. Maybe not quite the same as all of us have it, but they're going to be in the system somewhere and somebody has to take care of them. So if we're training 10,000 less residents per year at a real deal, because we're not paying the residents the same as a full paid physician, who's going to lose? It's going to be the indigent. It's going to be those on Medicaid. It's going to be the older population. So I don't think we should cut that. I think we should make sure that we have properly trained clinicians, put the money where we need to, emphasize primary care, preventive care. Yeah, we need to curb some of the things we do unnecessarily with tertiary care, some of the expensive imaging that we may or may not want. Now, I started out by comparing third world countries with ours. So if you're in one of those countries, you may not get that MRI or MRI-A with angiography to determine whether you had a bleed or not. So we have to determine, do we want to continue to function that way? Some of these countries that have the lower paying per capita don't have malpractice insurance. Of course we do. So fundamental changes are absolutely necessary if we're going to improve upon health care, get rid of the fraud and abuse and waste.
Thank you.
Can I say something about that just very briefly? Before you, it's about health care, and it'll only take a second. When I spoke about President Obama needing a willing partner to try to solve some of the problems that face us, one of the things is we spend, and I don't have the number, I can't remember the number off the top of my head, but some huge percentage of our Medicare expenses are in the last year of life, last 8 months. So one of the solutions there is to have a discussion with patients about what kind of care they want at the end of their lives. The death panels that we heard about, that the Tea Party railed against in the health care bill, those death panels were Medicare-paying doctors to have a discussion with their patients about end-of-life care. That's what that was. Because right now, doctors have those discussions with patients on their own nickel, and so they don't always do them, or they do them in a minute or two. So this was going to be Medicare paying to have that end-of-life discussion so that maybe we could ratchet down the amount of end-of-life care we provide voluntarily because the patient has given their informed consent that they don't want extraordinary measures. But in the absence of that information, in the absence of that medical power of attorney, the doctors are going to do whatever they can. So we tried to solve this problem, And the president got pilloried and ended up withdrawing the proposal. We caved. But that's what you need to have, willing partners. And if people are going to play politics rather than solve problems, we'll end up with a system that costs us too much and doesn't provide enough in return.
Yeah, that's perfect. I'm just going to say one thing real quick on that, because as an emergency physician practicing 30 years, I know that when patients come in who are at end of life and we don't have anything that says don't do advanced care, then we do advanced care, keep them living. I'm a member of the Hospice of the Piedmont Board now on the other end of that. And so I see just that very thing in terms of some things are not necessary, but it has to be documented and the discussion has to be had with the patient and with the family well in advance. And that's worth paying for.
I just one more thing that just dovetails with this. So I hear what you're saying, but remember that all of these issues are also tied to the loathsome profits of insurance companies and pharmaceutical firms. I don't know if anybody knows about this, but these drugs that they dangle in front of these families, they keep their loved ones alive for like 2 more weeks at a cost of like $50,000 a week or something like that happens. And so to me, insurance companies, I think I'd rather sell crack cocaine than work for an insurance company. They're horrible. And so, and that's, we can talk about, preventive medicine, and I'm all for that, but I am one of those people, I want my MRI. If you don't know what's wrong with me, I want you to find out. But at the same time, I understand what you're saying, but to me, the big kahuna is the obscene profits made by insurance companies and pharmaceutical firms. I've only had one hospital say, it was 2 years ago, my hospital deductible was $1,500. Well, they didn't keep me $1,500 worth of time, but they kept saying, I got the bill, I said I want a detailed bill. So I got the detailed bill, they had that I had 4 Advils for $84 each, which I know I didn't take because I snuck my own Advil into the room because I was forewarned about this. And they even said, the nurse came in and said, you wouldn't happen to have Advil with you, would you, in this room? I said, of course not. What kind of person do you think I am? But when I said I didn't get it, they were trying to ratchet it up to get to my $1,500 deductible. And they did it. And when I asked the insurance company, don't you care that like $3,000 of this wasn't done? They said, look, that's the deductible. That's the plan that your employer bought into, and you're just going to pay it. And I think that's stupid. But, to me, they're the bigger, that's a bigger problem than those of us like me who do not want to exercise and want to continue to eat Fritos.
Okay, I was taking notes. So a lot of times, I come from a community college, so I graduated high school a year early and went to community college instead and transferred here. And while I was there, I was working for the school. So I was working in the administrative offices and working hand in hand with all the administrators, and I saw how inefficient government can be. And even at the micro level, which is a community college in Northern Virginia, even at the micro level, I saw so much waste, so much red tape, and things that were implemented with good intentions that were just not working. The government gave us money, but the money was actually being spent on an excess of printer toners in the back storage room, and I saw that, and I had to count it, and I was devastated because this was money that could have easily gone to somebody more deserving or more efficiently. And as well as the fact that I have lots of friends who work for the government as a contractor or is voluntarily working for an agency there. And they've all concluded unanimously how inefficient government was, and that with the bureaucracies and the positions and the offices held in the bureaucracies, that it was impossible nearly to get anything done at an an individual level. So if somebody, or my boyfriend works for NIST, which is the National Institute of Standard Technology. All he does is do database updating, but he wanted to make the database more usable aesthetically, and coming from a professional background, he knew how to do it, but of course he couldn't do it. And examples like that make me totally believe that government is one of the most inefficient entities in the United States. So I'm wondering, why should the government expand, and why is it the government's job to give people jobs? Why do we allow this inefficiency to grow if we know that it's not working?
I'll start by responding, and thank you for that question. But I guess, and I think in some ways this question is representative of how the right, I think, has won the war in some respects ideologically, because it's always interesting to me how we have this dialogue about how government is wasteful. But if we trace this economic crisis backwards to previous economic crisis, then you're going to always find, at least in my readings, that has been preceded by fraud, corruption, inefficiencies on the part of the private sector. I mean, I think we can't lose sight of the fact that it is the decisions in the private sector that have brought us to the brink of economic calamity. And I think, I guess I would argue that there is a role for federal government. I mean, there's a role for, that's in some ways kind of our shield against social and economic barbarism. And so the idea that the federal government is inefficient, I guess we kind of have to be careful about that, because I think in some ways that's more of a political position in some respects, I would argue, than it is a reflection of the reality. Think, for instance, about the post office. And this is important because there's a whole conversation about the post office. Closing it or even more, because I think the whole move here is the whole argument against the public sector is toward the aim of privatization. This is what a lot of this is about. It's about deregulating, and it's about privatizing. I think there's a role for government. I mean, listen, the New Deal was not perfect, but one of the things that the New Deal did, and one of the things, first of all, that the Great Depression illustrated, is that if you leave the private sector to its own devices, then it will do exactly what has occurred here. It will self-destruct. It will destroy civilization and society. So you have to have a federal state that creates some kind of a bottom below which we will not allow our citizenry to fall. And I think the argument, in a sense, ideologically, has been one that somehow government is the problem, and that government doesn't have a role to play. And this is in part why I would disagree with you a little bit about kind of what's occurred here. That one of the things, certainly President Obama did not create this crisis. And certainly we know that the Tea Party represents some of the most reactionary, racist elements in this country. That's at least clear to me. But I think in some respects, one of the things that I do fault the president for is that he allowed the right to dictate the terms of conversation. So now we're talking about deficits, we're talking about cuts, or what have you, at a moment where people are homeless, people are not covered, people are without jobs. And that's, I think, one of the things. Now, of course, he has to have a willing partner. But, there were other options that he had on the table with regard to this debt ceiling crisis that he completely took off. All right, and I think we're seeing the impact of that. And so now we've had the threat of another shutdown, because folks have seen if you press the president, if you flex on him, then he will blink. And that's far afield from answering your question. So I'm sorry if I took it in that particular direction. But I guess I would challenge the idea, that that government is one of the most inefficient kind of, I think folks who receive Social Security, people who benefit from Medicare, people who benefit from Medicaid, people who drive on highways, people who cross bridges, people who have lights. I think there are a number of things that we all benefit from the existence of government that a lot of times we don't think about, and we benefit in ways that you can't necessarily track by whether you get a check from the government. But there are ways that you have some civility in society based on the fact. I'll stop there because I'm. Yeah, I think
That last is a very important point, and that's the difference between provision of goods, if you will, infrastructure, and provision of services. There has tended to be far less criticism of the effort to provide goods, the roads, the buildings that house government, some of the other things that are real tangible and that everybody can touch and feel and think they participated in. It gets a lot more difficult to try to monitor and keep up with services. And then there's always the problem that when you have the provision of anything through the private sector using government funds, I think that there's a tendency to try to make as much of it as you can. The military sector is not as large as it is necessarily because every dollar spent represents value or value added. It's because there is something provided, but it's been padded an awful lot along the way, and there are lots of instances of that. But I would point out that what you're talking about at some level goes to provision of services, and it's always been much more controversial, much more difficult, I think, to keep tabs on, at least in the eyes of those who are not taking advantage of it. And a part of what has to happen is that the credibility and integrity of those involved in government, day-to-day people like yourself who are employed there, that you do the best job you can and that you are good stewards of the public funds with which you have been provided in order to provide a service.
I was just going to say that you're not alone, and there's a Pew Trust poll that just shows that over half of American people think that government spending is inefficient, and even though it's supposed to be more efficient at the local level, 40% of local level money is supposed to be wasted. But as was suggested by Clarence, that government's function in society is to take care of those areas that the private sector has abandoned. And so you think about a research university. The reason why research universities conducted at universities is because it's not profit-making. And so the private sector has abandoned this. And so the innovation aspect of the United States, our ability to compete in all national defense and so on and so forth, is centered in organizations like this because the private sector has abandoned it for profit. And then again, the historical evidence is the private sector is often very inefficient and often very corrupt. And we talk about not just the recent financial crisis, but throughout history, these things are called bank panics. And the reason they're called bank panics is because the private sector has crumbled, forcing the economies into catastrophic situations. So ironically, the last time we came close to eliminating the national debt was 1836, when the national debt was down to $23,000. The banks got together, screwed it all up, had another bank panic, and the debt skyrocketed. But the presumption is that there's more efficiencies in the private sector, I think, is a testable one. And also, but because the responsibilities of the public sector is to make up for and to be a countervailing force to the failures that exist in the private sector.
And I'll say one minute's worth of stuff. One is there was head-to-head competition between Medicare and Medicare Advantage. Medicare Advantage being the private sector provided Medicare, Medicare itself being the government provided. The overhead for the government provided was 3%. The overhead for the privately provided was 14%. Which one was more efficient? The government provided one. The second thing I'd say is, if it weren't, it is up to the government to fill in those blanks where the private sector won't go. The FedEx isn't going to deliver mail out to rural America. The Postal Service has to do it, and it's very expensive. The private sector didn't want to provide electricity to rural America in the 1920s, so the federal government had to do it. So in the late 1920s, 90% of urban America was electrified, but only 10% of rural America. The federal government had to step in and do it because it wasn't worth the expense of running the lines out to rural America. The history is replete with examples of where the government steps in where the private sector will not go.
I'm Dr. Preston Reynolds. I've been advocating for universal health care since I was a medical student in the 1980s and have been a member of the American College of Physicians, which in 1991 published probably the first major statement on the need for universal health insurance from a professional, mainstream, largest specialty organization in the country. And I also helped write the health reform bill at the invitation of Labor HHS, focusing on the primary care workforce. We have a healthcare crisis in this country. 41 cents of every federal dollar goes to entitlement spending. Most of that is Medicare and Medicaid. Since 1980, healthcare expenditures, non-Medicare, Medicaid related, have increased 485%. That's NIH, that's CDC, that's SAMHSA, that's HRSA, that's all of the non-Medicare, Medicaid related expenses. Since 1980, Medicare and Medicaid have increased 425%. What is driving the deficit are healthcare costs. The beautiful thing about Obama's healthcare bill is that it really was a comprehensive restructuring of the way we deliver, the way we train, the way we pay for, the emphasis, so that it would move this country to a new healthcare model that was community-based, that was preventive, that was primary care, that was restructuring payment to emphasize value rather than volume. And part of the problem as a physician are physicians. We have a thing called the RUC, which is a membership group comprised of specialists, surgeons, technicians, who set Medicare payment rates for their services much, much higher than primary care physicians get paid. So that we as a country, through Medicare, are paying specialty physicians doing high-tech procedures 2 and 3 and 20 times more than we're paying primary care physicians to do the prevention, the chronic care, the cost-effective, the high-value care that this country needs and deserves. We have a healthcare crisis within the healthcare system. We also have a healthcare crisis within the American public who think that good care is an MRI, when in fact, bad care is an MRI when you don't need it. When you don't need it, it leads to more procedures, more interventions, and worse outcomes. This country spends 2 and 3 times more, the second most expensive country, and we are rated 37th in the world on maternity and mortality death statistics. We are at the level of a developing nation, and yet we spend horrific amounts of money on healthcare and get no value for it.
Well, I just want to say,
so,
don't mean to sound a proponent.
But
people are getting everything they want. But I'm going to tell you this: I don't know where you've been lately, but it's damn hard to get an MRI.
Well,
You're paying $400 a month for health insurance.
Well,
they're not doing them.
So I'm taking care of the poor and the vulnerable at UVA in the poor and vulnerable clinics. Mm-hmm. And it is a blessing that this hospital is a disproportionate share hospital. It enables us to provide comprehensive, preventive, chronic care management for some of the sickest and the poorest. That they come from West Virginia, Maryland, D.C., all parts of this state. But we have a healthcare crisis within the healthcare system and within the American public that does not understand what good health is all about, which a lot of it starts with our own individual responsibility. So we are a willing partner. We have been a willing partner. We continue to be a willing partner. Every organization I'm part of is a willing partner, and we continue to advocate for the survival of the health reform bill because it was the right set of things that were put and enacted into law. And I cannot say enough about the courage of this president to do what was right.
Okay, 2 last points, Maurice and the person in the back in the orange t-shirt.
Okay. My question is for Professor Savage. I didn't want us to end without going back to the essence of the debt care crisis itself, the economic history of it. It seems to me that you started off telling us a little bit about the trajectory of different ways in which debt crises have been talked about. And it seems to me that there's been a change of function over the years. what are some of the different ways in which it's been talked about, and what are the different ways in which this idea has been used to serve new and contemporary purposes?
Thank you. There's an industry in Washington that tries to talk about budget deficits in the economy and the debt issue a certain way that is anti-statist, anti-government. And there's this Committee on Responsible Federal Budget, which consists of all these old congressmen and who are middle of the road. You have the Cato Institute, you have the American Enterprise Institute, you have the Pew people, the Peterson Commission. These are all right-of-center organizations, and there's no countervailing intellectual force. When there used to be a language about full employment, and the full employment language included a calculation, as I mentioned before, about budget deficits. And this calculation allowed you to help set fiscal policy, and the goal was full employment. When Reagan became president, and I know because I interviewed all these guys, they consciously changed this language. The language became of structural budget deficits and other things. They got rid of all the full employment language. And full employment was also a goal of government. It was all these things were about putting people to work, and fiscal policy was directed in that manner. And the Republicans got rid of this language. They changed all the budget documents. They went through the commission reports of the president's economic commission people. The budget language was changed. They stripped all this language out. And the Democrats, when they finally got back to office, they had been so busy attacking Reagan's budget deficit for short-term success, to blame the budget deficit for all these horrible things. And when they got in office under Carter, and then before him Carter, and then Clinton, they didn't go back again. And so there's no carry-on language. And so, as I was referring to before, this language would tell you what is an appropriate fiscal policy. And so there are about 5 basic models of economics. And 4 of them are about balancing budgets. And there's only one that justifies having a budget deficit as a good thing, as a proactive thing. And if you believe in an activist fiscal government, if you believe in an activist state, you have to tie into this. This is the language of Keynesianism and neo-Keynesianism. And so Obama, to his credit, has resurrected to some extent this language, but you can see it under fire. You can read about it in the Financial Times and the Wall Street Journal, the intellectual battle that's going on so that this language is not sustained. There's an effort to snuff it out and to eliminate this legacy. But if you don't have this kind of intellectual debate at some level, then the other side wins. And so the discussions have been made here about characterizing fiscal policy, about how you talk about these things. I mean, we just had a conversation about healthcare. IME, GME, dish payments, all these things are on the table because of what's going on, because the Democrats have not found a voice to determine what is a good and a bad deficit. This affected the stimulus. So, okay, the budget deficit stimulus was the stimulus was $787 billion, Obama's stimulus as opposed to the Bush lesser stimulus, and yet he never talked about what an acceptable deficit would be. And so the language, the discourse became one where every dollar added to the deficit was a contribution to bad things happening in the economy. The same thing was true with Clinton. He never articulated one. So he had the health care plan that came from Hillary, which was a single-player plan. But the time was every dollar that contributed to a deficit was a horrible thing, making indirect charge, creating inflation, high interest rates, and so on and so forth. Just the final point is a measure of record. If you don't have high interest rates, bad things are not going on. You don't have crowding out of the economy because there's no competition for the funds. Interest rates are almost zero, which means there's no crowding out, no bad things are going on because of the budget deficits. But unless you just have this kind of engagement, the other side wins.
Hi, I think right now I'm just thinking a lot about this because of the execution of Troy Davis that happened last evening. And I really wanted to think, I've heard wars and tax cuts as part of the reason for this debt crisis. And I'm really interested in hearing some folks talk about, although maybe I'm the last word, the relationship between the prison industrial complex and the increased privatization of prison systems and the debt crisis that we're in today.
My notes cost because it costs a lot to execute people. Most people don't know that. And language is really important. I want to follow up on Professor Savage. Language is crucial, so that when I call something a death panel, that's not really a death panel. And we have an American populace that does not think critically, because when you say government is inefficient, the assumption is that the private sector is efficient. And all you have to do is work for IBM for a few years to find out what real inefficiency is. We're not thinking critically. So, yeah, the prison industrial complex, wow, it costs a lot to keep people in jail. But what's happened is that is an employment base for many communities, especially rural communities. California no longer is known for produce. It's known for prisons. And so it costs a lot. I teach a course called Money, Politics, and Prison. And as part of that course, I take my students to both Powhatan State Prison and the Richmond City Jail. And by far, the worst experience is the Richmond City Jail, where it was 108 degrees inside of that jail and 72 degrees outside. There were 26 prisoners per cell. But when you go to the commissary, does everybody in this room know that at Kroger, you can get 10 packages of ramen noodles, talking about poor health, for $1? Guess what? In the commissary, you can get 1 package of ramen noodles for $4.25. Families are sending money to prisoners so that they can eat, because they're no longer feeding them. And this is the state prison now, okay? We're still talking, when we talk about privatized prisons and what they do, it's just unbelievable on health. Powhatan State Prison. The psychiatrist was in, and he said that one of his biggest problems is that in Richmond City Jail, they give the inmates Halcyon, a very dangerous sleep drug, because there's so many of them. Well, when they get to Powhatan State Prison, they have liver failure because of the Halcyon. So they spend a lot of money on health care, shipping the prisoners and inmates back and forth to the hospital because they have so many health problems, based on the way things are handled. But have you ever heard of anybody lobbying for prisoners' rights? Because I haven't. And there's a reason that even the president never says working class or poor, ever. All I hear is middle class, middle class, middle class, middle class. And so part of the reasons is we kind of don't care. We have expendable people. We have a segment of the population that I think that we as Americans think just don't deserve to be considered. And that's why I say we're at an ideological crossroads. I think at some point we've got to make up our minds what kind of nation we're going to be.
May I just add one thing to that? I think what you just said was so important. A group of citizens who don't deserve to be considered. That's why I think that the language that was used in part of this debate, talking about the necessity of having skin in the game. I hate to go back to that. But the idea that you don't count if you don't pay is one that says it's okay to ignore 47% of Americans because they do not pay. I think it has to be very clear that all Americans are invested in the system. And if that takes some educating, and it does, then that has to happen. One last point, I was watching PBS last night, the PBS News. I do that occasionally, but I haven't had enough depressing news on the day. But they were talking about the wealth gap, and they had several charts that they took around to people who were gathered in various places, going into restaurants and that kind of thing. And they said, pick the one that you think shows what the distribution of wealth is in this country. And more often than not, the person to whom the question was put picked the graph that showed 20%, 20%, 20%, 20%. Where in fact, the top 10% owns like 84% of the wealth, 87%, and the top 1% owns 50%, and the bottom 1% owns the bottom, I can't remember, 47% or something owns 1 or 2%. The point is, it's extremely disproportionate, and people don't know it. Why don't they know this? We've got, we don't want.
Even if you tell them, Mildred, don't confuse me with the facts.
I
want to think what I want to think.
But somehow people have to understand that if the system is going to devalue them, then they have to understand what they are actually contributing to the system in order that they can insist that they be heard.
I want to thank this panel. I want to thank all of you. This is precisely the purpose of current conversation. We have been educated and enlightened greatly, and again,